At the peak of the global pandemic, these were busy corridors. The rooms of the Ga East Municipal Hospital in the Ga East district of the Greater Accra Region were full of patients, some brought in ambulances with sirens blowing. Today, all is calm with little activities but more practical training and simulation exercises by nurses. At the height of the COVID-19 pandemic, 1 year ago around this time in June 2020, nurses, doctors and specialists left nothing to chance. All hands were on deck to save lives and ensure the safety of frontline workers too.
As a hospital, it's been quite a journey and an experience for us. One moment we were getting ready to start regular clinical work. The next moment we were designated as a national treatment center. And there's a hospital that was still getting in, we're still recruiting staff, and we quickly had to convert units to manage COVID-19. It was a bit challenging getting the staff to accept it in the beginning because, as you know, now all our hospitals were running away. Nobody wanted to manage COVID. Everybody was scared. At that time, all we saw were deaths on the national TV in foreign countries, and everybody was scared, And then the issue of clients coming in terms of the COVID-19 positive patients in the various ambulances with their sirens. And I'm sure our neighbors were quite scared, have trunks of ambulances just driving in and out, blaring sirens. It was quite traumatic for some, for some of our staff, because some of them were stigmatized. Even knowing you work in Ga East Hospital alone and your community was an issue. Remember, aside the very old patients too, we were also managing all clients from the airport. Yeah, so that was one of our biggest challenges, because these were people who already, by the time they get here, were very peeved by the fact that instead of finding themselves in their homes, they find themselves in the treatment center. Some of them verbally abused our staff, some of them nearly physically abused our staff, very threatening to us. Some of them were very difficult to deal with, refused to follow protocols, So it was a bit of a challenge, and our staff were really put at risk during those difficult.
The facility, which was initially to start work in November 2020, after it formally opened in November 2019 to provide healthcare services to the people of Ga East Municipal Hospital, had to stop its operations to care for COVID-19 patients when Ghana recorded her first COVID-19 case on March 12. By the 21st of March 2020, the hospital was ready to receive its first COVID-19 patient.
The first patients were admitted at Ridge Regional Hospital, and then Tama General. And then as at 21st March, there was the realization that we had more than those facilities could take. So Ga East Municipal Hospital was brought on board. Because Ga East Hospital was a new hospital that had never been used before, the government then decided to designate the hospital as the National COVID-19 Treatment Center. And so the entire hospital was more or less converted into a treatment center. So as the first patient who walked into this hospital on the 9th of 21st March 2020 was a COVID-19 patient. The very first patient who came in was discharged. He was managed and discharged. We unfortunately lost the second patient who came in. Our last patient was discharged at the end of April, 28th April or so, when we moved out our last patient.
The facility from March 2020 was designated as the National COVID-19 Treatment Center, and until April 2021 had recorded over 2,842 COVID-19 cases with 39 deaths. Though some of its frontline health workers were infected too, none died.
As a treatment center, we did very well to help the country contain and manage the COVID-19 pandemic during the outbreak. I believe that if we hadn't had such a center readily available, we might have had a few challenges and probably might have seen more mortalities than we saw. as a country. So I think the staff of this hospital must be proud of themselves. I won't say there was any magic. We had a lot of training for the staff. Surprisingly, we were infected more during the second wave, and I think the second wave took us a bit of a surprise because everything seemed to be going very well for us as a country towards the end of 2020. Then January 2021, we had this huge surge, a more severe form of COVID-19, that's the UK variant. And the numbers initially were quite overwhelming. 2020, I think we had just about 2 members of staff being infected. But in 2021, between January and February alone, we had about 15 staff being infected with COVID-19. So it was quite severe. It tells you the level of exposure this year and the infectivity of the virus that we're dealing with.
With the setting up of the Ghana Infectious Disease Center, GIDC, by Corporate Ghana, authorities of the Ga East Municipal Hospital say all COVID-19 patients have been moved to the Infectious Disease Center to allow the municipal hospital to fully start operating as intended.
Space was available on our compound, so the Infectious Disease Center has been set up on the premises of Ga East Municipal Hospital. And that center is dedicated solely to the management of infectious diseases, one of which is COVID-19. So at the end of April, should I say at the beginning of May, we fully transitioned COVID-19 center from Ga East Municipal Hospital to the Ghana Infectious Disease Center. So although we are on the same premises, there are 2 separate facilities. One facility now manages mainstream clinical care, and the Infectious Disease Center still has a few COVID-19 patients on admission. We continuously continue to manage COVID-19 as the treatment center till late April, to the end of April, actually. We only transitioned from COVID-19 management in May 2021 and have since then been making frantic efforts to start mainstream clinical care.
Stigma and fear of being infected with COVID-19 is preventing many people from visiting the facility, but authorities of the Ga East Municipal Hospital are assuring that the facility is very safe for use.
All units have been brought on board effective June, and as we speak now, the wards are open and staffed by our clinical care team, as well as the outpatient services emergency room. Our challenge has been, of course, probably the issue of what Ga East has been known for, and that has created challenges for us because even my clients who have known me a while, when you ask them to come in, the first question is, hey, don't you have COVID patients there? You know, is the COVID in the air? What's the chances that I will get COVID when I come there? But I'm sure you'll notice that this is a very friendly environment. Where we managed COVID was actually far removed from the general area. We have disinfected the place about twice already. The wards are clean, equipments are clean. We are actually ready to start work. We are only waiting for the clients to come in. Yes. We have provisional accreditation for national health insurance, and we started accepting national health insurance as well. So we invite the general public to come in. Do not be scared. We are operating like any general hospital. When you go to Mamobi General Hospital, Achimota Hospital, Greater Accra Regional Hospital, Shao Sudoku District Hospital, wherever you go to, we are operating just as those hospitals. Where we have clients come in with suspected COVID, we triage them, we have them tested, we isolate them, and if they are proving positive, we were the National Treatment Center, but now we have moved on from there. So we also move the patients to a designated treatment center, but we do not keep the patients in our hospital anymore.
The 100-bed capacity Ga East Municipal Hospital currently has over 200 nurses and 20 doctors to provide quality health care for the people of the Ga East municipality and other adjoining municipalities. For GBC News, Mavis of Air Champon reporting.